The client who is 4 hours postoperative for abdominal surgery who is complaining of abdominal pain and has hypoactive bowel sounds. 2. The client who is 1 day postoperative for total hip replacement, THR, who has voided 550 ml of clear amber urine in the last 8 hours. 3. The client who is 8 hours postoperative for open cholecystectomy who has a T-tube draining green bile. 4. The client who is 12 hours postoperative for total knee replacement, TKR, who is complaining of numbness and tingling in the foot. 88. Which situation should the charge nurse in the critical care unit address first after receiving the shift report? 1. Talk to the family member who is irate over his loved one's nursing care. 2. Complete the 90-day probationary evaluation for a new ICU graduate intern. 3. Call the laboratory concerning the type and cross-match for a client who needs blood. 4. Arrange for a client to be transferred to the telemetry step-down unit. 89. The nurse in the critical care unit of a medical center answers the phone and the person says, "There is a bomb in the hospital kitchen." Which action should the nurse take? 1. Notify the kitchen that there is a bomb. 2. Call the operator to trace the phone call. 3. Notify the hospital security department. 4. Call the local police department. 90. The critical care unit is having problems with staff members clocking in late and clocking out early from the shift. Which statement by the charge nurse indicates he has a democratic leadership style? 1. You cannot clock out 1 minute before your shift is complete. 2. As long as your work is done you can clock out any time you want. 3. We are going to have a meeting to discuss the clocking in procedure. 4. The clinical manager will take care of anyone who clocks out early. 91. The nurse in the burn unit is preparing to perform a wound dressing change at the bedside. Which interventions should the nurse implement? Rank in order of priority. 1. Obtain the needed supplies for the procedure. 2. Explain the procedure to the client. 3. Remove the old dressing with non-sterile gloves. 4. Medicate the client with narcotic analgesics. 5. Assess the client's burned area. 92. Which client should the charge nurse of a long-term care facility see first after receiving shift report? 1. The client who is unhappy about being placed in a long-term care facility. 2. The client who wants to have the HCP to order a nightly glass of wine. 3. The client who is upset because the call light was not answered for 30 minutes. 4. The client whose son is being discharged from the hospital after heart surgery. Chapter 15 Comprehensive Exam 441 Comprehensive Exam 93. The male client in a long-term care facility complains that the staff does not listen to his complaints unless a family member also complains. Which action should the director of nurses implement? 1. Call a staff meeting and tell the staff to listen to the resident when he talks to them. 2. Determine who neglected to listen to the resident and place the staff member on leave. 3. Ignore the situation because a resident in long-term care cannot determine his needs. 4. Talk with the resident about his concerns and then initiate a plan of action. 94. The newly admitted client in a long-term care facility stays in the room and refuses to participate in client activities. Which statement is a priority for the nurse to discuss with the client? 1. You have to get out of this room or you will never make friends here at the home. 2. It is not so bad living here, you are lucky that we care about what happens to you. 3. You seem sad. Would you like to talk about how you are feeling about being here? 4. The activities director can arrange for someone to come and visit you in your room. 95. The charge nurse overhears 2 unlicensed assistive personnel, UAPs, discussing a client in the hallway. Which action should the charge nurse implement first? 1. Remind the UAPs that clients should not be discussed in a public area. 2. Tell the unit manager that the UAPs might have been overheard. 3. Have the UAPs review policies on client confidentiality and HIPAA. 4. Find some nursing tasks the UAPs can be performing at this time. 96. The family member of a client in a long-term care facility is unhappy with the care being provided for the loved one. Which person would be most appropriate to investigate the complaint and report the findings during a client care conference? 1. The ombudsperson for the facility. 2. The social worker for the facility. 3. The family member who is unhappy. 4. The director of nurses. 97. The 65-year-old client is being discharged from the hospital following major abdominal surgery and is unable to drive. Which referral should the nurse make to ensure continuity of care? 1. A church that can provide transportation. 2. A home health agency. 3. An outpatient clinic. 4. The healthcare provider's office. 98. The nurse in an assisted living facility notes that the male client has several new bruises on both of his arms and hands. Which intervention should the nurse implement first? 1. File an elder abuse report with the Department of Human Services. 2. Ask the client whether he has fallen and hurt himself during the night. 3. Check the medication administration record, MAR, to determine which medications the client is receiving. 4. Notify the client's family of the bruises so they are not surprised on their visit. 99. The resident in a long-term care facility tells the nurse, "I think my family just put me here to die because they think I am too much trouble." Which statement is the nurse's best response? 1. Can you tell me more about how you feel since your family placed you here? 2. Your family did what they felt was best for your safety. 3. Why would you think that about your family? They care for you. 4. Tell me, how much trouble were you when you were at home? 442. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 100. The admitting nurse is subpoenaed to give testimony in a case in which the client fell from the bed and fractured the left hip. The nurse initiated fall precautions on admission but was not on duty when the client fell. Which issue should the nurse be prepared to testify about the incident? 1. What preceded the client's fall from the bed? 2. The extent of injuries the client sustained. 3. The client's mental status before the incident. 4. The facility's policy covering falls prevention. 101. The charge nurse must notify a staff member to stay home because of low census. The unit currently has 35 clients who all have at least 1 4 and multiple 4 medications. The unit is staffed with 2 RNs, 3 licensed practical nurses, LPNs, and 3 unlicensed assistive personnel, UAPs. Which nurse should be notified to stay home? 1. The least experienced RN. 2. The most experienced LPN. 3. The UAP who asked to be requested off. 4. The UAP who was hired 4 weeks ago. 102. The charge nurse in an extended care facility notes an elderly male resident holding hands with an elderly female resident. Which intervention should the charge nurse implement? 1. Do nothing, because this is a natural human need. 2. Notify the family of the residents about the situation. 3. Separate the residents for all activities. 4. Call a care plan meeting with other staff members. 103. The Chief Nursing Officer, CNO, of an extended care facility is attending shift report with 2 charge nurses, and an argument about a resident's care ensues. Which action should the CNO implement first? 1. Ask the 2 charge nurses to stop arguing and go to a private area. 2. Listen to both sides of the argument and then implement a plan of care. 3. Ask the family to join the discussion before deciding how to implement care. 4. Tell the nurses to stop arguing and continue to give report. 104. Which action by the nurse is a violation of the Joint Commission's patient safety goals? 1. The surgery nurse calls a timeout when a discrepancy is noted on the surgical permit. 2. The unit nurse asks the client for his or her date of birth before administering medications. 3. The nurse educator gives the orientee the answers to the quiz covering the 4 pumps. 4. The admitting nurse initiates the facility's fall prevention program on an older adult client. 105. The community health nurse is triaging victims at a bus accident. Which client would the nurse categorize as red, priority 1? 1. The client with head trauma whose pupils are fixed and dilated. 2. The client with compound fractures of the tibia and fibula. 3. The client with a sprained right wrist with a 1-inch laceration. 4. The client with a piece of metal embedded in the right eye. 106. The clinic nurse is reviewing the laboratory data of clients seen in the clinic the previous day. Which client requires immediate intervention by the nurse? 1. The client whose white blood cell, WBC, count is 9.5 mm3. 2. The client whose cholesterol level is 230 mg/dl. 3. The client whose calcium level is 10.4 mg/dl. 4. The client whose international normalized ratio, INR, is 3.8. Chapter 15 Comprehensive Exam 443 Comprehensive Exam 107. The community health nurse is triaging victims at the scene of a building collapse. Which intervention should the nurse implement first? 1. Discuss the disaster situation with the media. 2. Write the client's name clearly in the disaster log. 3. Place disaster tags securely on the victims. 4. Identify an area for family members to wait. 108. Which statement best describes the role of the parish nurse? 1. The parish nurse practices holistic health care within a faith community. 2. The parish nurse cares for clients in a religious-based hospital. 3. The parish nurse practices nursing in a parish clinic. 4. The parish nurse is a licensed practical nurse, LPN, who cares for clients in the home. 109. The HH aide calls the HH nurse to report that the client has a reddened area on the sacral area. Which intervention should the nurse implement first? 1. Notify the client's healthcare provider. 2. Visit the client to assess the reddened area. 3. Document the finding in the client's chart. 4. Refer the client to the wound care nurse. 110. The 32-year-old male client with a traumatic right above the elbow amputation tells the home health, HH, nurse he is worried about supporting his family and finding employment since he can't be a mechanic anymore. Which intervention should the nurse implement? 1. Contact the HH agency's occupational therapist. 2. Refer the client to the State Rehabilitation Commission. 3. Ask the HH agency's social worker about disability. 4. Suggest he talk to his wife about his concerns. 111. The labor and delivery nurse has assisted in the delivery of a 37-week fetal demise. Which intervention should the nurse implement? 1. Remove the baby from the delivery area quickly. 2. Tell the father to arrange to take the infant home. 3. Wrap the infant in a towel and place it aside. 4. Obtain a lock of the infant's hair for the parents. 112. The newborn nursery nurse has received report. Which client should the nurse assess first? 1. The 2-hour-old infant who has nasal flaring and is grunting. 2. The 6-hour-old infant who has not passed meconium stool. 3. The 12-hour-old infant who refuses to latch onto the breast. 4. The 24-hour-old infant who has a positive startle reflex. 113. The psychiatric clinic nurse is returning telephone calls. Which telephone call should the nurse return first? 1. The female client who reports being slapped by her husband when he got drunk last night. 2. The male client who reports he is tired of living, since his wife just left him because he lost his job. 3. The female client diagnosed with anorexia who reports she does not think she can stand to eat today. 4. The male client diagnosed with Parkinson's disease who reports his hands are shaking more than yesterday. 114. The psychiatric nurse and mental health worker, MHW, on a psychiatric unit are caring for a group of clients. Which nursing task should the nurse delegate to the MHW? 1. Take the school-aged children to the on-campus classroom. 2. Lead a group therapy session on behavior control. 3. Explain the purpose of recreation therapy to the client. 4. Give a bipolar client a bed bath and shampoo the hair. 444 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam 115. The 36-year-old client in the Women's Health Clinic is being prescribed birth control pills. Which information is important for the nurse to teach the client? Select all that apply. 1. Do not smoke while taking birth control pills. 2. Take one pill at the same time every day. 3. If a birth control pill is missed, do not double up. 4. Stop taking the pill if breakthrough bleeding occurs. 5. There can be interactions with other medications. 116. The nurse is caring for a female client 3 days post-knee replacement surgery when the client complains of vaginal itching. The Medication Administration Report, MAR, indicates the client has been receiving the antacid calcium carbonate, Maalox, the antibiotic ceftriaxone, Rosfin, and the anticoagulant enoxaparin, Lovenox. Which priority intervention should the nurse implement? 1. Request the dietary department to send yogurt on each tray. 2. Explain to the client this is the result of the antibiotic therapy. 3. Notify the HCP on rounds of the client's vaginal itching. 4. Ask the client whether she is having unprotected sexual activity. 117. The nurse manager of the maternal child department is developing the budget for the next fiscal year. Which statement best explains the first step of the budgetary process? 1. Ask the staff for input about needed equipment. 2. Assess any new department project for costs. 3. Review the department's current year budget. 4. Explain the new budget requirements to the staff. 118. The nurse on the psychiatric unit observes one client shove another client. Which intervention should the nurse implement first? 1. Discuss the aggressive behavior with the client. 2. Document the occurrence in the client's chart. 3. Approach the client with another staff member. 4. Instruct the client to go to the unit's quiet room. 119. The client in the operating room states, "I don't think I will have this surgery after all." Which intervention should the nurse implement first? 1. Have the surgeon speak with the client. 2. Ask the client to discuss the concerns. 3. Continue to prep the client for surgery. 4. Immediately stop the surgical procedure. 120. Which data indicates therapy has been effective for the client diagnosed with bipolar disorder? 1. The client only has 4 episodes of mania in 6 months. 2. The client goes to work every day for 9 months. 3. The client wears a nightgown to the day room for therapy. 4. The client has had 3 motor vehicle accidents. Chapter 15 Comprehensive Exam 445 Comprehensive Exam 446 Prioritization, Delegation, and Management of Care for the NCLEX-RN Registered Exam. The correct answer number and rationale for why it is the correct answer are given in boldface type. Rationales for why the other possible answer options are incorrect also are given, but they are not in boldface type. 1. The new graduate must work under this charge nurse. Confronting the nurse would not resolve the issue because the nurse can choose to ignore the new graduate. Someone in authority over the charge nurse must address the situation with the nurse. 2. The night supervisor or the unit manager has the authority to require the charge nurse to submit to drug screening. In this case, the supervisor on duty should handle the situation. 3. The new graduate is bound by the Nursing Practice Acts to report potentially unsafe behavior regardless of the position the nurse holds. 4. The nurse educator would not be in a position of authority over the charge nurse. Content, Management of Care, Category of Health Alteration, Management of Care, Integrated Processes, Nursing Process, Implementation, Client Needs, Safe and Effective Care Environment, Management of Care, Cognitive Level, Application 2. 1. The nurse should stop the behavior from occurring in a public place. The charge nurse can discuss the issue with the UAPs and determine whether the manager should be notified. 2. The first action is to stop the argument from occurring in a public place. The charge nurse should not discuss the UAP's behavior in public. 3. The second action is to have the UAPs go to a private area before resuming the conversation. 4. The charge nurse may need to mediate the disagreement. This would be the third step. Content: management of care, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 3. 1. The graduate nurse should handle the situation directly with the UAP first before notifying the charge nurse. 2. This may need to be completed, but not prior to directly discussing the behavior with the UAP. 3. The graduate nurse must address the insubordination with the UAP, not just complete the tasks that are the responsibility of the UAP. 4. The graduate nurse must discuss the insubordination directly with the UAP first. The nurse must give objective data as to when and where the UAP did not follow through with the completion of assigned tasks. Content: management of care, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 4. 1. This should not be implemented until verification of the allegation is complete, and the shift manager has discussed the situation with the UAP. 2. The shift manager should have objective data prior to confronting the UAP about the allegation of falsifying vital signs. Therefore, the shift manager should take the client's vital signs and compare them with the UAP's results before taking any other action. 3. The shift manager should not confront the UAP until objective data are obtained to support the allegation. 4. Written documentation should be the last action when resolving staff issues. Content: management of care, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, synthesis 5. 1. The nurse should first assess the client prior to taking any other action to determine if the client is experiencing any untoward reaction. 2. An incident report must be completed by the nurse but not prior to taking care of the client. 3. The nurse should administer the correct medication but not prior to assessing the client. 4. The client's HCP must be notified, but the nurse should be able to provide the HCP with pertinent client information, so this is not the first intervention. Content: medical/surgical, category of health alteration, medication administration, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 6. 1. The serum blood glucose level requires a venipuncture, which is not within the scope. Answers and Rationales Chapter 15 Comprehensive Exam 447 of the UAP's expertise. The laboratory technician would be responsible for obtaining a venipuncture. 2. This is a sterile dressing change and requires assessing the insertion site for infection, therefore, this would not be the most appropriate task to assign to the LPN. 3. The nurse should ask the UAP to bathe the client and change bed linens because this is a task the UAP can perform. The LPN could be assigned higher level tasks. 4. The UAP can add up the urine output for the 12-hour shift, however, the nurse is responsible for evaluating whether the urine output is what is expected for the client. Content: medical/surgical, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 7. 1. The client on the ventilator is unstable. Therefore, the nurse should not delegate any tasks to the UAP. 2. The UAP can take specimens to the laboratory, these are not medications and they are not vital to the client. 3. The client in an Addisonian crisis is unstable, therefore, the nurse should not delegate any tasks to the UAP. 4. The UAP cannot assist the HCP with an invasive procedure at the bedside. Content: medical/surgical, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. 8. 1. The client must have lost decision-making capacity because of a condition that is not reversible or must be in a condition that is specified under state law, such as a terminal, persistent vegetative state, irreversible coma, or as specified in the advance directive. A client who is exhibiting decerebrate posturing is unconscious and unable to make decisions. 2. The client on a ventilator has not lost the ability to make healthcare decisions. The nurse can communicate by asking the client to blink his or her eyes to yes/no questions. 3. The client receiving dialysis is alert and does not lose the ability to make decisions, therefore, the advance directive should not be consulted to make decisions for the client. 4. Mental retardation does not mean the client cannot make decisions for him or herself unless the client has a legal guardian who has a durable power of attorney for health care. If the client has a legal guardian, then the client cannot complete an advance directive. Content: medical/surgical, integrated processes, nursing process, assessment, client needs, psychosocial integrity, cognitive level, analysis. 9. 1. The UAP can apply sequential compression devices to the client on strict bed rest. 2. The UAP can assist with a portable stat chest X-ray, as long as it is not a female UAP who is pregnant. 3. The client will need to be pre-medicated for a wound debridement, therefore, this task cannot be delegated to the UAP. 4. The UAP can obtain intake and output for clients. Content: medical/surgical, integrated process, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis. 10. 1. A quality improvement project looks at the way tasks are performed and attempts to see whether the system can be improved. A medication delivery system in which it takes a long time for the nurse to receive a stat or now medication is an example of a system that needs improvement, and should be addressed by a quality improvement committee. 2. Financial reimbursement of the staff is a management issue, not a quality improvement issue. 3. Collective bargaining is an administrative issue, not a quality improvement issue. 4. The number of medication errors committed by a nurse is a management-to-nurse issue and does not involve a systems issue, unless several nurses have committed the same error because the system is not functioning properly. Content: medical/surgical, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. 11. 1. A secondary nursing intervention includes screening for early detection. The bone density evaluation will determine the density of the bone and is diagnostic for osteoporosis. 2. Spinal screening examinations are performed on adolescents to detect scoliosis. This is a secondary nursing intervention, but not to detect osteoporosis. 3. Teaching the client is a primary nursing intervention. This is an appropriate intervention to help prevent osteoporosis, but it is not a secondary intervention. Exam answers 448. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. 4. Discussing risk factors is an appropriate intervention, but it is not a secondary nursing intervention. Content: medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis. 12. 1. Isometric exercises such as weightlifting increase muscle mass. The HH nurse should not instruct the HH aide to do this type of exercises. 2. The HH aide may go to the emergency department, but the HH nurse should address the aide's back pain. Many times, the person with back pain does not need to be seen in the emergency room. 3. An occurrence report explaining the situation is important documentation and should be completed. It provides the staff member with the required documentation to begin a workers' compensation case for payment of medical bills. However, the HH nurse on the phone should help decrease the HH aide's pain, not worry about paperwork. For the HH aide is in pain, and applying ice to the back will help decrease pain and inflammation. The HH nurse should be concerned about a co-worker's pain. Remember, ice for acute pain and heat for chronic pain. Content: medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application 13. 1. Allowing the client to stay in bed is inappropriate because a client with osteoarthritis should be encouraged to move, which will decrease the pain. 2. A bath at the bedside does not require as much movement from the client as getting up and walking to the shower. This is not an appropriate action for a client with osteoarthritis. 3. Movement and warm or hot water will help decrease the pain. The worst thing the client can do is not to move. The HH aide should encourage the client to get up and take a warm shower or bath. 4. Osteoarthritis is a chronic condition, and the HCP could not do anything to keep the client from hurting all over. Content: medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, application 14. 1. The HH aide's responsibility is to care for the client's personal needs, which includes assisting with AM care. 2. The HH aide is not responsible for cooking the client's meals. 3. The HH aide is not responsible for taking the client to appointments. This also presents an insurance problem, because the client would be riding in the HH aide's car. 4. Even in the home, the HH nurse should not delegate teaching. Content: medical/surgical, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 15. 1. The UAP may be at risk of contacting the illness. 2. The UAP should wear appropriate personal protective equipment when providing any type of care. 3. The UAP should not be told to skip performing assigned tasks. 4. The fetus is not affected by anthrax. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, planning, client needs, safe and effective care environment, safety and infection control, cognitive level, synthesis 16. 1. The mortuary service is considered part of the healthcare team in this case. The personnel in the funeral home should be made aware of the client's diagnosis. 2. The mortuary service is considered part of the healthcare team. In this case, the personnel in the funeral home should be made aware of the client's diagnosis. 3. The nurse does not need to ask the family for permission to protect the funeral home workers. 4. The nurse, not the HCP, releases the body to the funeral home. Content: medical/surgical, category of health alteration, communicable disease, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 17. 1. The clients would not understand the importance of the specific tasks. Clients will tell the nurse whether the UAP is pleasant when in the room but not whether the delegated tasks have been completed. 2. The nurse retains responsibility for the delegated tasks. The charge nurse may be able to tell the nurse that the UAP has been checked Chapter 15 Comprehensive Exam 449 off as being competent to perform the care but would not know whether the care was actually provided. 3. The nurse retains responsibility for the care. Making rounds to see that the care has been provided is the best method to evaluate the care. 4. The nurse would not have time to complete his or her own work if the nurse watched the UAP perform all of the UAP's work. Content: medical/surgical, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 18. 1. A client in a crisis should be assigned to the registered nurse, RN. 2. Biliary atresia involves liver failure, involving multiple body systems. This client should be assigned to the RN. 3. Anaphylaxis is an emergency situation. The client should be assigned to the RN. 4. The LPN can administer routine medications and care for clients who have no life-threatening conditions. Content, medical/surgical, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, safety and infection control, cognitive level, synthesis 19. 1. The nurse would expect the client with DIC to be oozing blood, therefore, the nurse should not need to assess this client first. 2. The nurse would expect the client with BPH to have urinary signs and symptoms such as terminal dribbling, so the nurse should not need to assess this client first. 3. The nurse would not expect the client with renal calculi to have blood in the urine, hematuria, and the pain should not be severe, therefore, this client should be assessed to determine if the client is having complications. 4. The nurse would expect the client with Addison's disease to have a bronze pigmentation and hypoglycemia, therefore, the nurse should not need to assess this client first. Content, medical/surgical, category of health alteration, genitourinary, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis 20. 1. The most experienced nurse should be assigned to the client who requires teaching and evaluation of knowledge for home health care, because the client is in the surgery center for less than 1 day. 2. A routine preoperative client does not require the most experienced nurse. 3. Any nurse can administer and monitor blood transfusion to the client. 4. Although the creation of an arteriovenous fistula requires assessment and teaching on the part of the most experienced nurse, this client is not being discharged home at this time. Content, medical/surgical, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 21. 1. The Glasgow Coma Scale ranges from 0 to 15, with 15 indicating the client's neurological status is intact. A Glasgow Coma Scale score of 13 indicates the client is stable and would be the most appropriate client to assign to the graduate nurse. 2. This client's K+ level is low, and the client is at risk for developing cardiac dysrhythmias, therefore, the client should be assigned to a more experienced nurse. 3. This client has a low blood pressure and evidence of tachycardia and could possibly go into an Addisonian crisis, which is a potentially life-threatening condition. A more experienced nurse should be assigned to this client. 4. A positive Trousseau sign indicates the client is hypocalcemic and is experiencing a complication of the surgery, therefore, this client should be assigned to a more experienced nurse. Content, medical/surgical, category of health alteration, neurological, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 22. 1. The therapeutic PTT level should be 11/2 to 2 times the control. Most controls average 36 seconds, so the therapeutic levels of heparin would place the control between 54 and 72. With a PTT of 92, the client is at risk for bleeding, and the heparin drip should be held. The nurse should assess this client first. 2. A client diagnosed with pneumonia would be expected to have a fever. This client can be seen after the client diagnosed with a DVT. 3. Cystitis is inflammation of the urinary bladder, and burning on urination is an expected symptom. 4. Pancreatitis is a very painful condition. Pain is a priority but not over the potential for hemorrhage. Exam answers 450. Prioritization, delegation, and management of care for the NCLEX-RN registered exam content, medical/surgical, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care. Cognitive level, synthesis 23. 3, 4, and 5 are correct. 1. Teaching is the responsibility of the nurse and cannot be delegated to a UAP. 2. The word check indicates a step in the assessment process, and the nurse cannot delegate assessing to a UAP. 3. The client is 2 days postoperative and vital signs should be stable, so the UAP can take vital signs. The nurse must make sure the UAP knows when to immediately notify him/her of vital signs not within the guidelines the nurse provides to the UAP. 4. This action does not require judgment on the part of the UAP, it does not require assessing, teaching, or evaluating. This can be delegated to the UAP. 5. A client who is 2 days postoperative should be ambulating frequently. The UAP can perform this task. Content, medical/surgical, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 24. 1. Staff members will not stay if forced to always use their paid time off for the hospital's convenience. 2. This nurse wants to take time off. Therefore, it is the best option to let the nurse desiring to be off from work to take time off if all other situations are equal. 3. The nurse will not gain experience if always requested not to come to work, and presumably this nurse would not have benefit time to pay for the time out of work. 4. This nurse could be allowed to stay home only if the nurse is still ill. Content, medical/surgical, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 25. 1. A nurse, not the UAP, should perform sterile dressing changes. 2. This client is unstable, and a nurse should perform this task. 3. The UAP can check to see the amount of food the residents consumed and document the information. 4. This is the job of the activity director and volunteers working with the activities department. Staffing is limited in any nursing area, the UAP should be assigned a nursing task. Content, medical/surgical, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 26. 1. The charge nurse is not the nurse educator but is responsible for the UAPs working under him or her. This is adding additional duties to the charge nurse. 2. The director of nurses should encourage responsible behavior on the part of all staff. The charge nurse is performing a part of the responsibility of the charge nurse and should be encouraged to work with the UAP. 3. Because this is not a private conversation about a client, there is no reason for the charge nurse to be told to go to a private area. The charge nurse is not reprimanding the UAP. 4. The director of nurses should not interfere with a better explanation. This could intimidate the charge nurse and make it difficult for the charge nurse to perform his or her duties. Content, medical/surgical, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 27. 1. Wound debriding formulations are medications, and a UAP cannot administer medications. 2. The UAP can position the resident so that pressure is not placed on the resident's heels. 3. The UAP can turn the resident. 4. The UAP can give the resident a protein shake to drink. Content: medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 28. 1. The nurse should implement the least restrictive measures to ensure client safety. Restraining a client is one of the last measures implemented. 2. Moving the client near the nursing station where the staff can closely observe the client is one of the first measures in most fall prevention policies. 3. This is considered medical restraints and is one of the last measures taken to prevent falls. 4. 4 side rails are considered a restraint. Research has shown that having 4 side rails up does not prevent falls and only gives the client farther to fall when the client climbs over the rails before falling to the floor. Chapter 15 Comprehensive Exam 451 Content: medical/surgical, category of health alteration, safety, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 29. 1. The first intervention is for the nurse to ensure the client is safe in the home. Assessing for grab bars in the bathroom is addressing the safety of the client. 2. Taking a shower in a stall shower may be safer than getting in and out of a bathtub, but the nurse should first determine whether the client has grab bars and safety equipment even when taking a shower. 3. According to the NCLEX-RN registered test blueprint for management of care, the nurse must be knowledgeable of referrals. The physical therapist is able to help the client with transferring, ambulation, and other lower extremity difficulties and is an appropriate intervention, but it is not the nurse's first intervention. Safety is priority. 4. NSAIDs are used to decrease the pain of osteoarthritis, but this intervention will not address safety issues for the client getting into and out of the bathtub. Content: medical/surgical, category of health alteration, safety, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, synthesis 30. 1. The employee health nurse should keep the clients at the clinic or send them to the emergency department. The clients should be kept together until the cause of their illnesses is determined. If it is determined that the clients are stable and not contagious, they should be driven home. 2. The employee health nurse should be aware that 6 clients with the same signs/symptoms indicate a potential deliberate or accidental dispersal of toxic or infectious agents. The nurse must notify the public health department so that an investigation of the cause can be instituted and appropriate action to contain the cause can be taken. 3. As long as the clients are stable, the nurse should keep the clients in the employee health clinic. These clients should not be exposed to other clients and emergency department staff. If the clients must be transferred, decontamination procedures may need to be instituted. 4. The client may need to provide stool specimens, but this would be done at the emergency department. Employee health clinics do not have laboratory facilities to perform tests on stools. Content: medical/surgical, category of health alteration, infection control, integrated processes, nursing process, implementation, client needs, safe effective care environment, safety and infection control, cognitive level, application 31. 1. This child needs an X-ray to rule out a fractured left leg, but this is not life-threatening. 2. Drooling and not wanting to swallow are the cardinal signs of epiglottitis, which is potentially life-threatening. This child should be assessed first. The nurse should not attempt to visualize the throat area and should allow the HCP to do this in case an emergency tracheostomy is required. 3. A child usually does not complain of a headache and this child should be assessed, but it is not life-threatening. 4. This client may have type 1 diabetes mellitus and should be assessed, but this is not life-threatening at this time. Content: medical/surgical, category of health alteration, pediatrics, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis 32. 1. This is an example of community-based nursing where nurses care for a client living in the community. 2. Community-oriented, population-focused nursing practice involves the engagement of nursing in promoting and protecting the health of populations, not individuals in the community. Therefore, this is an example of community-oriented, population-focused nursing. 3. This is an example of community-based nursing where nurses care for a client living in the community. 4. This is an example of community-based nursing where nurses care for a client living in the community. Content: medical/surgical, category of health alteration, community health, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, comprehension 33. 1. Dyspnea and confusion are not expected in a client diagnosed with AIDS, therefore, this client would warrant a more experienced nurse to assess the reason for the complications. 2. The client with financial problems should be assigned to a social worker, not to a nurse. 3. A full thickness, 3rd degree, burn is the most serious burn and requires excellent exam answers. 452 Prioritization, delegation, and management of care for the NCLEX-RN registered exam assessment skills to determine whether complications are occurring. This client should be assigned to a more experienced nurse. 4. The client diagnosed with diabetic neuropathy would be expected to have pain, therefore, this client could be assigned to a nurse new to home health nursing. The client is not exhibiting a complication or an unexpected sign/symptom. Content: medical/surgical, category of health alteration, endocrine, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 34. 1. The nurse cannot delegate assessment to the HH aide. 2. The HH aide cannot assess the incisional wound, and the wound should be assessed. The nurse cannot delegate assessment. 3. The HH aide can place the right leg on 2 pillows. This task does not require assessment, teaching, or evaluating, and the client is stable. 4. Mopping the floor is not part of the HH aide's responsibility. This is not an appropriate task to delegate. Content: medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 35. 1. The nurse would expect the client diagnosed with a myocardial infarction to have an elevated troponin level, thus, the nurse would not assess this client first. 2. Because the client's PTT of 68 seconds is 1.5 to 2 times the normal range, it is considered therapeutic and would not warrant the nurses assessing this client first. 3. The nurse would expect a client with end-stage liver failure to have an elevated ammonia level. 4. The therapeutic range for dilantin is 10 to 20 mg/dl. This client's higher level warrants intervention because the serum level is above the therapeutic range. Content: medical/surgical, category of health alteration, laboratory values, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 36. 1. This client would not benefit from acupuncture. 2. Mental health issues are not treated with acupuncture. They may be treated with herbal supplements. 3. The client with asthma must be treated with a medical regime. 4. Acupuncture, the most common complementary therapy recommended by healthcare providers, would benefit a client with osteoarthritis. Content: medical/surgical, category of health alteration, complementary alternative medicine, integrated processes, diagnosis, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis 37. 1. The nurse should not make the client dependent on family members to prepare meals. If the family were willing to do this, they would probably already be doing it. 2. The occupational therapist would teach the client how to cook, but this client is 88 years old and needs meals provided. Therefore, providing meals through Meals on Wheels is the most appropriate intervention. 3. The HHAID's duties do not include cooking all 3 meals for the client. 4. Meals on Wheels delivers a hot, nutritionally balanced meal once a day on weekdays, usually at noon for older people who do not have assistance in the home for food preparation. This intervention would be most helpful to the client. Content: medical/surgical, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 38. 1. HH Care Agency employees are responsible for knowing and adhering to the professional boundary crossing standards. The nurse should not discuss this with the client. 2. Home health care agencies are required by law to address the concepts in the National Association for Home Care, NAHC, Bill of Rights with all home health clients on the initial visit. The agencies may also make additions to the NAHC's original Bill of Rights. 3. The nurse should discuss this with the client, but it is not a legal intervention. 4. This is a true statement, but it is not a legal intervention. If the client is not homebound, he or she is not eligible for home health care. Content: legal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 39. 1. Taping petroleum gauze over the chest tube insertion site will prevent air from entering the pleural space. This is the first intervention. Chapter 15 Comprehensive Exam 453-2. The nurse should make sure the UAP knows the correct method to assist a client with a chest tube, but the safety of the client is the first priority. 3. This is the second intervention the nurse should implement. Remember, if the client is in distress and the nurse can do something to relieve that distress, then the nurse should not assess first. The nurse should take action to take care of the client. 4. The nurse should obtain the necessary equipment for the HCP to reinsert the chest tube, but the priority intervention is to prevent air from entering the pleural space. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 40. 1. The LPN can administer routine medications. 2. The UAP, not the LPN, should be assigned to take the routine vital signs. 3. The unit secretary, not an LPN, should be assigned to transcribe the HCP orders. 4. The RN, not the LPN, should assess the urinary output of the client. The RN should not delegate assessment. Content: management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 41. 1. The clinical manager may need to discuss the MAR with some nurses individually, but it is not the clinical manager's first intervention. 2. The first intervention should be to arrange meetings to explain the new MAR and allow nurses to ask questions to clarify the new policy. 3. The clinical manager can provide a written handout explaining the new MAR, but the first intervention should be small discussion groups. 4. A video is an excellent tool for explaining new procedures, but the first intervention should be small discussion groups so that all questions can be answered. Content: medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 42. 1. The nurse would expect the client with an abdominal aortic aneurysm to have an audible bruit, therefore, this client does not warrant immediate intervention. 2. The nurse would expect the client with ARDS to have respiratory signs/symptoms. Therefore, this client does not warrant immediate intervention. 3. One of the signs/symptoms of bacterial meningitis is knuckle rigidity, therefore, this client does not warrant immediate intervention. 4. The client with Crohn's disease should be asymptomatic, so pain and diarrhea warrant intervention by the nurse. Pain could indicate a complication. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 43. 1. The client with chronic kidney disease, CKD, would have an elevated creatinine level. The normal creatinine level is 0.7 to 1.8 mg/dl. The data would not warrant immediate intervention. 2. Peritonitis, inflammation of the peritoneum, is a serious complication that would result in a hard, rigid abdomen, therefore, a soft abdomen would not warrant immediate intervention. 3. The dialysate return should be colorless or straw-colored but should never be cloudy, which indicates an infection, therefore, the data warrant immediate intervention. 4. Because the client has ESRD, fluid must be removed from the body, so the output should be more than the amount instilled. Therefore, this indicates the peritoneal dialysis is effective and does not warrant intervention. Content, medical/surgical, category of health alteration, genitourinary, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 44. 1. The nurse could ask this question, but the client has already told the nurse that 3 years have passed, so the client has tried approximately 36 times. 2. This is the best question to assess the client. The nurse would not want to suggest an intervention that has been futile. 3. Infertility treatments are very expensive, but the nurse should assess the client's attempts. 4. This question is not helpful for assessing the client or addressing the client's statement. Exam answers 454. Prioritization, delegation, and management of care for the NCLEX-RN registered exam. Content, medical/surgical, category of health alteration, family planning, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential. Cognitive level, application 45. 1. The reason that the first pregnancy did not yield a viable infant is not relevant at this time. The relevant information is whether the mother received the REGAM injection. 2. The important information to assess is whether the client received the REGAM injection within 72 hours of the loss of the first pregnancy. If the client did not receive the injection, the fetus is at risk for erythroblastosis fetalis, blue baby. 3. This is not important information at this time. 4. This is not important information at this time. Content, medical/surgical, category of health alteration, maternity, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 46. 1, 3, and 5 are correct. 1. This child has injuries consistent with child abuse. Child Protective Services and the police should be notified. 2. This could result in not being able to prosecute the perpetrator if the nurse is not trained in forensic medicine. 3. The nurse should determine the full extent of the child's injuries. 4. The nurse should not notify the parent of the potential involvement. The police are fully capable of doing this for themselves. The nurse could instigate an inflammatory situation with this action. 5. The child needs X-ray studies to determine the extent of internal injuries. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 47. Correct answer, 5, 3, 2, 4, 1 5. Taking the vital signs is part of the assessment and a beginning point for the nurse. 3. Since the child has been losing fluids, the nurse should assess tissue turgor to try and determine if fluid replacement by the parents has been effective. 2. The nurse should make sure that the parents do not leave the child alone in the room, making sure the parents are aware of any safety measures used to protect the toddler from abduction, and how to call the nurse in case of need. 4. The client will need diapers. They should be available to the parents so the diaper can be changed and the child will not develop skin irritation problems. 1. When the nurse provides the diapers, it is a good opportunity for the nurse to teach the parents about weighing the diapers before and after the child soils them. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, synthesis 48. 1. This client is exhibiting signs and symptoms of a potentially fatal complication of DVT pulmonary embolism. The nurse should assess this client first. 2. Refusing to eat hospital food should be discussed with the client, but the nurse could ask the unit secretary to have the dietitian see the client. 3. Clients diagnosed with pancreatitis have nasogastric tubes to rest the bowel. However, these tubes are typically uncomfortable. Regardless, the nurse should see this client after the client diagnosed with DVT has been assessed and appropriate interventions initiated. The nurse should discuss the importance of maintaining the tube with the client. 4. This is an expected symptom of osteoarthritis. This client does not need to be assessed first. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, synthesis 49. 1. This is not an appropriate delegation. Taking the UAP from the floor to stay with the child so the parent can smoke is supporting a bad health habit. 2. The play therapist will stay with the client during the therapy. 3. The respiratory therapist will position the client for postural therapy. 4. The UAP is capable of completing intake and output on clients. Weighing a diaper is the method of obtaining the output in an infant. Content, pediatrics, category of health alteration, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis chapter 15 comprehensive exam 455-50. 1. This client may be developing a complication of immobility, one of which is pneumonia. The nurse should assess this client first. 2. Loss of weight in a client with CHF indicates the client is responding to therapy. This client does not need to be assessed first. 3. Pressure ulcers are a chronic problem, which frequently occur in clients who are paralyzed. This client does not need to be assessed first. 4. Paralysis is expected for a CVA. This client does not need to be assessed first. Content, medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, synthesis 51. 1. The nurse should first medicate the client since this procedure is very painful for the client. 2. The nurse should prepare the equipment, but not prior to medicating the client. This should be done 30 minutes before procedure starts. 3. The nurse should use non-sterile gloves to remove the old dressing but not prior to medicating the client. 4. The nurse should don sterile gloves, can put one on dominant hand, but not prior to medicating client. Content: medical/surgical, category of health alteration, integumentary, integrated processes, nursing process, implementation, client needs, physiological integrity, basic care and comfort, cognitive level, application making nursing decisions. When the question asks the nurse which intervention to implement first, it means all the options are plausible. The nurse should not select equipment first over taking care of the client's body, pain medication. 52.1. Administering pain medication is the nurse's responsibility, not that of the UAP. 2. A washcloth should be provided to the client before a meal, but not before ambulating with the physical therapist. 3. The client should be ready to work on therapy when the physical therapist arrives. The UAP should make sure the client has used the bathroom or has not been incontinent before the therapist arrives, thus making the most efficient use of the therapist's time. 4. Obtaining a walker that is the correct height for the client is the physical therapist's responsibility, not that of the UAP. Content: medical, category of health alteration, musculoskeletal, integrated processes, nursing process, planning, client needs, physiological integrity, reduction of risk potential, cognitive level, synthesis. 53. 1. The fact that the client is a neighbor of the volunteer has no bearing on whether or not the nurse can discuss a client's condition with the volunteer. The nurse should inform the volunteer that information obtained inadvertently is still confidential. 2. The nurse cannot release the client's information in layperson's or medical terms. This is a violation of the Health Insurance Portability and Accountability Act, HIPAA. In many facilities, the client can give a password to individuals who can receive information about the client's condition. 3. The nurse should not discuss the situation with the client. This would alert the client to potential breaches in confidentiality. 4. The nurse should remind the volunteer of the HIPAA and confidentiality rules that govern any information concerning clients in a healthcare setting. Content: legal, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application. 54. 1. Under shared governance, some nurses become so involved with the management of facilities that they are no longer eligible for representation by a bargaining agent, union, but there are no guarantees. 2. The manager is responsible for disseminating information under a centralized system of organization. 3. Shared governance is an organizational framework in which the nurse has autonomy over his or her own practice. The nurse is given direct input into the working of the unit. 4. Shared governance is a system in which the nurse represents himself or herself. Content: legal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application. 55. 1. This might be the second statement for the nurse to make if the client does not calm down and discuss the problems with the nurse. Because it could escalate the anger, it should not be the first statement. 2. The nurse should remain calm and try to allow the client to vent his frustrations in a more acceptable manner. The nurse should repeat calmly in a low voice any instructions given to the client. 3. This statement will escalate the situation and could cause the visitor to lash out at the nurse. Exam answers 456. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 4. This statement will escalate the situation and could cause the visitor to lash out at the nurse. Content: mental health, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application. 56. 1. The nurse should leave if he determines that the staffing is not now or ever will be as it was relayed to him in the interview. However, there may be a temporary situation that can be resolved. 2. The nurse should give the manager a chance to discuss the situation before quitting. A temporary problem, such as illness, may be affecting staffing. 3. This action could cause the manager to think of the new nurse as a troublemaker. 4. The nurse should not discuss this with the charge nurse because this may cause a rift between the charge nurse and the new nurse. The nurse should clarify the staffing situation with the unit manager. Content: management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 57. Correct answer: 1, 5, 2, 3, 4, 1. This is the first intervention the nurse should implement. Checking the HCP's order is priority. 5. This is the second intervention. The nurse should not administer the antibiotic if it is not compatible with the primary 4. 2. This is the third intervention the nurse should implement. Determining if the antibiotic is compatible is second, because client allergies won't be assessed if the medication is not compatible. 3. This is the fourth intervention. The secondary piggyback, antibiotic, must be hung above the primary 4 bag so the secondary piggyback will infuse. 4. This is the fifth intervention. Ensuring the right rate is necessary prior to starting the infusion. Content: medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, planning, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, synthesis 58. 1. Checking the client's armband is done prior to actually administering the medications, but it is not the first action for the nurse to take. 2. The nurse should have assessed the client's foresight on first rounds. At this time, all medications to be administered are oral. 3. This is part of the 2 identifier system of medication administration implemented to prevent medication errors, but it is not the first action for the nurse to take. 4. The nurse should assess the client's last potassium, K+, level because hypokalemia, abnormally low K+ level, is the most common cause of dysrhythmias in clients receiving digoxin secondary to clients concurrently taking diuretics. Furosemide, Lasix, is a loop diuretic. The nurse should check for digoxin and K+ levels and apical pulse, AP, prior to administering digoxin. Content: medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, assessment, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, analysis 59. 1. This client has been on a medication to control the angina for 2 days and could be discharged. 2. This client is currently completing the amount of care that would be provided in the hospital setting. The client can be taught to continue the Coumadin at home and return to the HCP's office for blood work, or a home health nurse can be assigned to go to the client's home and draw blood for the lab work. 3. Because resistant infections are very difficult to treat, this client should remain in the hospital for the required IVPB medication. 4. These blood gases are expected for a client diagnosed with COPD. This client could go home with oxygen and home health follow-up care. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis 60. 1. The nurse may wish to consult the hospital's attorneys or retain an attorney of his or her own, but this is not the first action for the nurse. 2. The nurse should be familiar with the chart and the situation so that details can be remembered. This should be the nurse's first action. 3. It is too late to purchase liability insurance to cover the current situation. The nurse may wish to purchase insurance for any future litigation. 4. The nurse should refrain from discussing the case with anyone who could be called as a witness or be named in the suit. Chapter 15 Comprehensive Exam 457 Content: Legal, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 61. 1. One of the many jobs of a manager is to see that performance evaluations are completed on the staff. 2. The manager should receive input from many sources to make decisions. Some decisions are made for the manager by administration based on costs or any number of other reasons. 3. The nurses retain responsibility for their own actions because they practice under the state's Nursing Practice Act. The manager retains responsibility for the functioning of the unit. 4. The nurse manager attends many meetings pertaining to nursing but attends medical committee meetings only when a nursing issue is being discussed. Content: management of care, category of health alteration, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 62. 1. Usually, the charge nurse should attempt to settle a conflict at the lowest level possible, in this case, confronting the nurse. However, the charge nurse does not have the authority to require a drug screen, which is the intervention needed in this situation. The nurse should notify the unit manager. 2. The charge nurse does not have the authority to force the nurse to submit to a drug screening, which is what this behavior suggests. Therefore, the charge nurse should not confront the staff nurse. The nurse should notify the supervisor. 3. Nurses have the right to take breaks with or without their peers. The charge nurse cannot enforce this option. 4. An occurrence report is not used for this type of situation. This is a management or a peer review issue. The nurse can go through the manager or a peer review committee. Content: management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 63. 1. Telling jokes with sexual innuendos creates a hostile work environment and should be addressed with the HCP. This is a courtesy to the HCP to allow him to correct the behavior without being embarrassed. 2. If the behavior is not corrected, then the nurse should report the HCP to the manager or chief nursing officer, CNO. The manager or CNO may find it necessary to report the behavior to the medical staff committee or president. 3. The charge nurse should first report the behavior to the manager and then, if the problem is not resolved, to the CNO, in other words, follow the chain of command. 4. Some facilities have a code for staff to use when an HCP is acting out, but it is rarely, if ever, used. Content: management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 64. 1. The nurse would not need to notify the surgeon of the client's refusal because this is a situation the nurse should manage. 2. Feeling a pop after an abdominal hysterectomy may indicate possible wound dehiscence, which is a surgical emergency and requires the nurse to notify the surgeon via telephone. 3. This situation indicates that it is time for the nurse to reinfuse the lost blood. 4. A negative Kvostek sign is normal and indicates the calcium level is within normal limits. Content: medical/surgical, integrated processes, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis 65. 1. The client who had an endotracheal tube would have a sore throat, therefore, the PACU nurse would not assess this client first. 2. A pulse oximeter reading of less than 93% indicates an oxygenation problem, therefore, this client should be assessed first. 3. Epidural surgery affects the lower extremities, so a palpable pedal pulse indicates a sufficient blood supply, this client should not be assessed first. 4. Drainage of green bile from the nasogastric, N/G, tube is normal, therefore, this client should not be seen first. Content: medical/surgical, category of health alteration, respiratory, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis processes 66. 1. After assessing the client's vital signs, the nurse may need to increase the client's intravenous rate, but it is not the first intervention. 2. The nurse should assess the client's vital signs but not prior to stopping the bleeding. Exam answers 458. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 3. The nurse should keep a large tourniquet at the client's bedside and should apply it when suspecting arterial bleeding. This is the nurse's first intervention. 4. The nurse will need to notify the client's HCP, but the nurse must first address the immediate concern, hemorrhaging. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application. Making nursing decisions, when the question asks the test taker to identify the first intervention, it means one or more of the options are interventions a nurse could implement. The test taker can ask, is the client in distress? If the client is in distress, do not assess. 67.1. The nurse should always document the findings in the chart, but the first intervention is to get help since the client has neurovascular compromise. 2. Elevating the client's right hand will not help neurovascular compromise. 3. The Doppler can be used to assess the radial pulse, but this client is experiencing neurovascular compromise, which requires immediate medical intervention. 4. The client is exhibiting severe neurovascular compromise, which indicates a surgical complication and requires notifying the surgeon immediately. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application. Making nursing decisions, the nurse must realize when the client is experiencing a surgical emergency that requires a medical intervention. The nurse should not select equipment, a Doppler, over the client's body. 68.1. The first time a client ambulates after hip surgery should be with a physical therapist or a nurse qualified to evaluate the client's ability to ambulate safely with a walker. The UAP does not have these qualifications. 2. According to the National Council of State Boards of Nursing, NCSBN, collaboration with interdisciplinary team members is part of the management of care. Physical therapy is responsible for management of the client's ability to move and transfer. 3. The physical therapist will measure and obtain the correct walker for the client. 4. The social worker is not responsible for assisting the client to ambulate, but may assist the client on discharge in obtaining needed medical equipment in the home. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application 69. 1. The UAP is being paid to assist the nurse to care for clients on the surgical unit, not take clients downstairs to smoke. 2. The UAP can take vital signs on a newly admitted client. 3. The client has a tube into the stomach via the abdominal wall that requires assessing the residual to determine whether the stomach is digesting the tube feeding. This task is not appropriate to delegate to the UAP. 4. If the toes are cold, have a capillary refill time of more than 3 seconds, or are pale, the nurse must make a judgment as to the circulatory status of the foot, therefore, the nurse would not delegate this task. Content, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 70. 1. The LPN can bathe the client, but this should be assigned to the UAP, thereby allowing the LPN to perform a higher level task. 2. The LPN can document the amount of food the client eats, but this should be assigned to the UAP, thereby allowing the LPN to perform a higher level task. 3. According to the NCLEX-RN registered test plan, collaboration with interdisciplinary team members is part of the management of care. The activity director of the long-term care facility would be responsible for this activity. 4. The LPN scope of practice allows routine sterile procedures on the client who is stable, such as clients in a surgical rehabilitation facility. Content, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 71. 1. Any member of the staff can change the sharps container when it is full. There is an OSHA fine if the sharps containers are over the full line. 2. The housekeeping department can change the sharps container as well as any staff member. 3. The nurse should reward appropriate behavior by the other healthcare members. Chapter 15 Comprehensive Exam 459 Verbal praise is always appreciated by anyone. 4. The nurse could let the clinical manager know the UAP was emptying the sharps container, but the best action is to directly praise the UAP. Content, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 72. 1. The nurse should assess the client's neurovascular status when the UAP reports any abnormality. 2. The client should be repositioned by log rolling, but it is not appropriate when the client has a neurovascular compromise. 3. The nurse should assess the client whenever receiving any information from another member of the healthcare team. 4. The nurse should not request another member of the healthcare team to assess a client who is exhibiting a possible surgical complication. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application 73. 1. The client who has just returned from surgery should not be transferred from the ICU because he or she may not be stable. 2. A sigmoid colostomy is a surgical procedure that causes major fluid shifts and has the potential for multiple complications. Therefore, this client should not be transferred to the surgical unit. 3. Although the client is only 1 day postoperative for a total hip replacement, it is an elective procedure, which indicates that the client was stable prior to the surgery. The incision is also dry and intact. Of the 4 clients, this client is the most stable and should be transferred to the surgical unit. 4. A fat embolism is a potentially life-threatening complication of a fracture, therefore, this client should not be transferred from the ICU. Content, medical/surgical, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 74. 1. Family members should be asked to stay in the client's room until the lights come back on. This helps ensure safety of the family members. 2. During an electrical failure, the red outlets in the hospital run on the backup generator, and all 4 pumps and necessary equipment should be plugged into these outlets. 3. The hospital may provide tap bells for contacting the hospital staff, but would not provide flashlights to all clients. The hospital staff would need the flashlights. 4. The charge nurse should not tie up the phone lines during an emergency situation, the phones may not even be working. Content, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 75. 1. The charge nurse should contact the laboratory, but the first action should be to address the HCP's behavior in a private area. 2. This is the charge nurse's first action because it will diffuse the HCP's anger. Inappropriate behavior at the nurse's station should not occur in an area where visitors, clients, or staff will observe the behavior. 3. The HCP can call the laboratory and share his or her concerns, but it is not the first intervention. 4. The charge nurse has the option to report any HCP's inappropriate behavior, but the immediate situation must be dealt with first. Content, management of care, integrated processes, nursing process, implementation, client needs, physiological integrity, reduction of risk potential, cognitive level, application 76. 1. The staff nurse should go through the chain of command when wanting to investigate a problem. 2. Possibly increasing infection rates among clients with PICS falls within the infection control nurse's scope of practice, and the infection control nursing staff will have data from all units in the hospital. 3. The nurse should follow through with investigating a potential problem, but this problem does not fall within the scope of practice of the employee health nurse. 4. The staff nurse should be a part of the solution to a problem. Volunteering is a good action to effect change, but it is not the first action. More information which the infection control nurse can provide is necessary first. Content, medical/surgical, category of health alteration, infectious disease, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 77. 1. Because there are multiple surgical clients requiring custodial care, the charge nurse exam answers 460 prioritization, delegation, and management of care for the NCLEX-RN registered exam should not send an experienced UAP to the medical unit. 2. The charge nurse should not send the experienced RN to the medical unit because this nurse represents the strength of the staff. 3. The LPN would be the most appropriate staff to send to the medical unit because the LPN has experience on the unit. His or her expertise is also not required to perform custodial care. 4. A new orientee should not be sent to an unfamiliar area. Content, management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 78. Correct answer, 2, 4, 3, 1. The nurse must remember the acronym RACE, which is a recognized national standard for fire safety in healthcare facilities. 2R is for rescue. 4A is for alert. 3C is for confine. 1E is for extinguish. Content, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application 79. 1. The nurse should notify the operating room team, but according to the Joint Commission, the first intervention is to call a timeout, which stops the surgery until clarification is obtained. 2. According to the Joint Commission, the first intervention is to call a timeout, which stops the surgery until clarification is obtained. 3. The nurse should discuss this with the client but should first initiate the timeout procedure. 4. Calling the surgeon is a part of the timeout procedure, so the first intervention is to call the timeout. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 80. 1. The nurse should initiate a client care conference to discuss the client's feelings, but at this time the most appropriate response is to allow the client to begin the grieving process. 2. The nurse could notify the social worker about the client's situation, but the most appropriate response is to allow the client to begin the grieving process, which the client often goes through when experiencing any type of loss. In this situation, the client is losing her independence and her home. 3. The client does not owe the nurse an explanation for feelings. 4. According to the NCLEX-RN registered test plan, Advocacy is part of management of care under safe and effective care environment client needs. Therapeutic communication involves being an advocate in this situation, because sometimes the nurse cannot prevent a perceived bad situation from occurring. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 81. 1. The client cannot be restrained as needed. The nurse must have documentation for the need and an HCP-specific order that includes reason for restraint and time limited to no more than 24 hours. This HCP order should be clarified. 2. The client in restraints should be offered fluids at least every 2 hours. 3. Hand mitts are the least restrictive limb restraints and can be used to help prevent the client from pulling out lines. 4. The nurse must check to ensure that restrained limbs have adequate circulation at least every 2 hours. Content, medical/surgical, category of health alteration, mental health, integrated processes, nursing process, diagnosis, client needs, safe and effective care environment, safety and infection control, cognitive level, analysis 82. 1. The RN is responsible for assessing clients. Therefore, this is an appropriate assignment. 2. The LPN may be allowed administer some IVP medications in some facilities, but the word all makes this an inappropriate assignment. Many IVP medications are considered high risk, and only RNs should administer such IVP medications. 3. This option has the word all, but it is within the scope of the UAP to complete the AM care. The RN and LPN can perform AM care, but it should be assigned to the UAP. 4. The RN should monitor laboratory values because this requires interpretation, evaluation, and notification of the HCP in some instances. Content, medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, planning, client needs, safe and Chapter 15 Comprehensive Exam 461 Effective Care Environment, Management of Care, Cognitive Level, Synthesis 83. 1. Tardiness information is objective data obtained for all employees in the facility, but it does not specifically provide information about the nurse's performance. 2. The attitude of the nurse is very subjective to evaluate and does not specifically provide information about the nurse's performance. 3. Thank you notes from the clients are nice for the nurse to receive, but they are not taken into consideration during the evaluation process of the nurse. 4. The nurse's ability to document client care directly correlates with the nurse's performance, therefore, these data should be included in the yearly evaluation. Content, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 84. 1. The home healthcare agency would not be the best referral because comorbid conditions increase the client's recovery time. The client at home does not have access to healthcare 24 hours a day. 2. A senior citizen center may help the client's psychosocial needs but not the client's rehabilitation needs. 3. The rehabilitation facility will provide intensive therapy and address the comorbid conditions 24 hours a day. This will assist in the client's recovery. 4. An outpatient physical therapist does not have the education to address and care for the comorbid issues. The physical therapist is focused on the hip fracture only, and the client may have transportation problems going to an outpatient clinic. Content, medical/surgical, category of health alteration, musculoskeletal, integrated processes, nursing process, planning, client needs, psychosocial integrity, cognitive level, synthesis 85. 1. The nasogastric tube should be replaced, but this task will require more time and acquiring new equipment, therefore, it should not be done first. 2. The client scheduled for surgery is priority and must be ready when the OR calls. Therefore, completing the preoperative checklist is the first task the nurse should implement. The preoperative checklist ensures the client's safety. 3. The client being discharged can wait until the safety needs of the client going to surgery have been addressed. 4. This is a minimal to moderate amount of drainage, which requires a dressing change, but not prior to making sure the client going to surgery is ready. Content: medical/surgical, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 86. 1. Antiplatelet medication will increase the client's bleeding time and should be held 5 days prior to surgery, therefore, this medication should be questioned. 2. A client with a TKR is at risk for developing deep vein thrombosis, DVT. Therefore, an anticoagulant medication would not be questioned. 3. The client with a Whipple procedure has had part of the pancreas removed and is placed on insulin, therefore, the nurse would not question administering Humalog. 4. An aminoglycoside antibiotic is not in the penicillin family, therefore, the nurse would not question administering this medication. Content: medical/surgical, category of health alteration, drug administration, integrated processes, nursing process, implementation, client needs, physiological integrity, pharmacological and parenteral therapies, cognitive level, application 87. 1. A client who is 4 hours postoperative for abdominal surgery would be expected to have abdominal pain and hypoactive bowel sounds secondary to general anesthesia. This client would not be assessed first. 2. This output indicates the client is voiding at least 30 ml an hour. Therefore, the nurse would not assess this client first. 3. The client with an open cholecystectomy frequently has a T-tube that would normally drain green bile. This client would not be assessed first. 4. The client is exhibiting signs of compromised circulation. Therefore, the nurse should assess this client first. The nurse should assess for the 6 Ps, pain, pulse, paresthesia, paralysis, pallor, and polar, cold. Content: medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, assessment, client needs, physiological integrity, reduction of risk potential, cognitive level, analysis 88. 1. This situation should be addressed first because the charge nurse is responsible for family/client complaints. If the family contacts the administration, the charge nurse must be aware of the situation. Exam answers 462. Prioritization, delegation, and management of care for the NCLEX-RN registered exam 2. The evaluation needs to be completed, but it does not take priority over handling an irate family member. 3. The charge nurse could assign this task to another nurse or ward clerk. Dealing appropriately with an irate family member takes priority over calling the laboratory. 4. The charge nurse could assign this task to another nurse or ward clerk. Dealing appropriately with an irate family member takes priority over transferring a client. Content: management of care, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 89. 1. Notifying the kitchen will only scare the kitchen personnel and will not alert the bomb squad as to the situation. 2. The operator would not be able to trace a phone call that has been disconnected. 3. The chain of command in a hospital is to notify the security department, and they will institute the hospital procedure for the bomb threat. 4. The nurse should not directly call the local police department because the hospital security department is responsible for implementing the procedure for a bomb scare. Content: management of care, integrated processes, nursing process, implementation, client needs, safe effective care environment, management of care, cognitive level, application 90. 1. Autocratic managers use an authoritarian approach to direct the activities of others. 2. Laissez-faire managers maintain a permissive climate with little direction or control. 3. A democratic manager is people-oriented and emphasizes efficient group functioning. The environment is open and communication flows both ways, and this includes having meetings to discuss concerns. 4. This statement reflects shirking of responsibility, thus letting someone else address the problem, and is not characteristic of a democratic manager. Content: management of care, integrated processes, nursing process, evaluation, client needs, safe and effective care environment, management of care, cognitive level, synthesis 91. Correct answer: 2, 4, 1, 3, 5, 2. The nurse should always explain the procedure to the client even if the client has had the procedure done before. For this procedure is very painful and the nurse should pre-medicate the client 30 minutes prior to performing wound care. 1. Obtaining the needed supplies can be done after pre-medicating the client since the nurse should wait 30 minutes after medicating the client. 3. The nurse should remove the old dressing. 5. The nurse should assess the burned area for signs of infection, viable tissue, or any eschar. Content: medical/surgical, category of health alteration, integumentary, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application. Making nursing decisions, the test taker must rank the nursing interventions in order of priority. 92.1. This client will require time to adjust to living in an extended care facility. This would be an expected reaction. 2. This client may or may not be allowed a glass of wine at night. Some long-term care facilities do allow the client to have a controlled amount of alcohol with an HCP order and the family supplying the alcohol, but this client is not priority. 3. This client may or may not have a valid complaint. The nurse should investigate whether or not the complaint is true. Failure to answer a call light can result in the clients attempting to ambulate without assistance and could be a safety issue. The nurse should speak with this client first. 4. The nurse is not in control of the client's son and his discharge, but if the son is being discharged, it can be assumed that the son is in a stable condition, and it is not a priority for the charge nurse to see this client. Content: management of care, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis 93. 1. The director of nurses must first understand the extent of the complaint. Telling staff to ignore preconceived ideas about older adult clients does not work. The director of nurses should have valid information to discuss with the staff. 2. The client has a general complaint, and so more than one staff member may have ignored the client's statements. Neglect was not mentioned in the stem of the question. Not treating the client with the dignity that the client deserves is implied. 3. This is a false statement. Some residents in a long-term care facility may not be able to Chapter 15 Comprehensive Exam 463 determine their needs, but this is not true of all residents. 4. The director of nurses should discuss the resident's complaints with the resident and then determine a plan of action to remedy the situation. Content: management of care, integrated processes, nursing process, assessment, client needs, safe and effective care environment, management of care, cognitive level, analysis 94. 1. This may be a true statement, but this client is exhibiting symptoms of depression. The client may or may not wish to make friends at the facility. 2. This is not acknowledging the client's feelings. 3. This client is exhibiting symptoms of depression. Therapeutic conversation is implemented to help the client vent feelings. This statement acknowledges the client's feeling and offers help. 4. This action may get the client to interact with other people, but it does not acknowledge the client's feelings. Content: medical/surgical, category of health alteration, mental health, integrated processes, nursing process, evaluation, client needs, psychosocial integrity, cognitive level, synthesis 95. 1. The charge nurse should remind the UAPs not to discuss confidential information in a public place. This is the first action. 2. The charge nurse may need to inform the manager of the breach of confidentiality, but the first action is to stop the conversation. 3. The charge nurse and/or the manager may need to make sure the UAPs are familiar with confidentiality, but the conversation should be terminated first. 4. This might be a better activity for the UAPs, but the first action is to stop the conversation. Content, legal, integrated processes, nursing process, implementation, client needs, safe and effective care environment, management of care, cognitive level, application 96. 1. An ombudsman is a representative appointed to receive and investigate complaints made by individuals of abuses or capricious acts. All Medicare and Medicaid long-term care facilities must have an ombudsman to act as a neutral party in matters of dispute with the facility. This is the best person to investigate a complaint. 2. The social worker is employed by the facility and is not the best person to investigate the complaint. 3. The upset family member should attend the conference but should have the ombudsman investigate the complaint. 4. The director will be biased. The best person to investigate the validity of the complaint is the ombudsman. Content, legal, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 97. 1. The nurse should not refer the client to a church or volunteer organization to ensure continuity of care. The organization's work may depend on unpaid individuals, and a volunteer may or may not be available to transport the client when needed. 2. The nurse should refer the client to a home health agency for follow-up care. The nurse will go to the client's home to assess the client and perform dressing changes. The home health agency will also assess the client and the client's home for further needs. 3. The client is unable to drive and would not be able to get to an outpatient clinic. 4. The client is unable to drive and would not be able to get to the HCP's office. Content, medical/surgical, category of health alteration, gastrointestinal, integrated processes, nursing process, planning, client needs, physiological integrity, physiological adaptation, cognitive level, synthesis 98. 1. The nurse must assess the cause of the bruises before filing a report of abuse. The nurse would file a report of elder abuse only if it is determined that the client has been abused. 2. The nurse should ask the client whether there is a reason for the bruises that the nurse should be aware of. This is the first intervention and can be done while the nurse is currently with the client. 3. The nurse should check the client's MAR to see whether he is currently on a medication, such as warfarin, Coumadin, or a systemic steroid, that would increase the risk for bruising. However, this would be done after talking with the client because the bruising is new, and bruising from the medications can take several days to weeks to develop. 4. The family may need to be notified but not until the nurse assesses the situation. Content, management of care, integrated processes, nursing process, implementation, client needs, safe and effective care environment, safety and infection control, cognitive level, application exam answers 464 prioritization, delegation, and management of care for the NCLEX-RN registered exam 99. 1. The client is expressing negative feelings about being placed in the nursing home. Asking about the client's feelings is a therapeutic response that encourages the client to discuss his or her feelings. 2. This is not acknowledging the client's feelings and is non-therapeutic because it is a judgmental statement. 3. The client does not owe the nurse an explanation. Why is never therapeutic? 4. This is assuming the client is correct in being trouble at home and agreeing that the family would punish the client for being a problem. Content, mental health, integrated processes, nursing process, implementation, client needs, psychosocial integrity, cognitive level, application 100. 1. The nurse cannot testify to what preceded the client's fall because the nurse was not on duty at the time. 2. The nurse was not on duty to assess the client's injuries, so any information about the injuries received from the fall would have to be hearsay or obtained from the chart. 3. The nurse cannot testify to the client's mental status prior to the fall because the nurse was not on duty at the time. 4. The nurse initiated a policy that is designed to prevent falls from occurring. This is all the nurse can testify to. Content: legal, integrated processes, nursing process, diagnosis, client needs, safe and effective care environment, management of care, cognitive level, knowledge 101. 1. The registered nurse, experienced or not, can be assigned nursing duties of assessment, planning, teaching, and other duties that cannot be delegated or assigned. The charge nurse has only 2 RNs for 35 clients. This nurse should not be requested to stay home. 2. An experienced LPN will be needed by the unit to care for the many 4 lines and medications. 3. The UAP cannot administer medications or IVs and has requested to be allowed to stay home. This is the best staff member to request to stay home. 4. This UAP may be less experienced on the floor but has not worked long enough to receive any paid time off, and this could greatly affect the UAP's pay. Content: management of care, integrated processes, nursing process, planning, client needs, safe and effective care environment, management of care, cognitive level, synthesis 102. 1. The charge nurse does not have a right to interfere with 2 consenting adults having a relationship. Doing nothing is the correct action for the charge nurse. If one of the residents involved is incapable of giving consent to a relationship, then the charge nurse would need to get involved. 2. 2 consenting adults have a right to form a bond. The family does not have a right to interfere with the expression of a basic human need, to form an intimate relationship with another human being. 3. The residents have the right to companionship. They should be allowed to participate in any activity that they wish, when they wish. 4. This is a normal situation, and no care plan meeting is needed. Content: management of care, integrated processes, nursing process, implementation,